What's happening, everybody? Dr. Z here, and welcome to episode number 148. And today we're going to be talking about diabetes complications and all of the complications that have to do with diabetes. Um, and we're gonna be talking about the different types of complications. And the first thing like I wanted to talk about was like, did you know that the leading cause of blindness in the world is actually diabetes? In the U.S., is actually diabetes, so it's the leading cause of blindness, and it's pretty crazy. And I've heard this before that, but when we were looking through all the data and stuff to for this episode, I was like surprised to learn that again. Even just hearing that again, it's kind of crazy. So many people are going blind because of type 2 diabetes, and so it's just pretty insane. And so, as we talked in the previous videos, we know that type 2 diabetes is about 90% of most diabetes. Type 1 is only 10%, and type 2 is mainly in adults. Type 1 is mainly in children, but that's changing now. The two are changing, and but let's focus on today, which is the main thing, is the complications of type 2 diabetes, and actually of all diabetes. So the first thing to kind of think about is that the diabetes is, it affects the whole body, right? And so it can affect the whole body, and the way that it does that is kind of like, if you think about it as in the highways, um, if you have highways, all roads in the, in a map, and there is like big highways, and then there is like small highways. And so the big highways are just the main highways that everybody takes, and then there is little highways in little small towns everywhere, right? And so diabetes affects both of them, and they both look differently. And so the big highways in our bodies are like the big vessels, and so the word big, macro, vascular for vessels. So those are the big vessels in our bodies. Diabetes affects those. But today we're gonna be talking about the main uh, effect that diabetes has in the small little vessels, which is microvascular, so the small vessels. And so those are three main things that diabetes has effect in these small vessels: is the eyes, the kidneys, and our nerves. And so, as we talked about before, it's pretty crazy that that diabetes is the leading cause of blindness in the world. And so, how does that happen? Well, our eyes are actually pretty. They have a lot of little vessels inside of them, and they actually have this layer of nerves. That these nerves are almost like light sensors, and they can sense light in different ways. And so then it sends a signal into our brains, and then our brains can look at that as vision, as stuff that we're seeing. And around this little layer of nerves, of sensors, there is like blood vessels, so it's like fuel to be able for these nerves to function. And so in type 1 and in diabetes period, what happens in these little blood vessels is that they start getting weaker and weaker and weaker, and then they start leaking. And then as they start leaking, they start causing damage. It's almost like having like a leak, like a leaking pipe in your house. It's going to start creating damage in the walls. It's going to start creating damage, all sorts of damage. And so then that's what it starts causing in the eye. And I'm gonna show you a picture here for those of you guys that are watching on YouTube. Um, this right here. And then for those of you guys who are listening, so right now we're looking at this picture, right, of the eye. And this is the picture who's taken with the little thing that the doctor can put into your eye. And that is, it shines a little light. And what you can see through this little light is actually the only place in the body that you can see the vessels, like the actual arteries and veins, from the outside, which is kind of cool, right? So you can take a little one of those little flashlights that the doctors have, and we use this to look inside the eye. And actually, it's one of the only areas around the body that we can actually see inside the body, which is kind of cool. But anyway, so here we can see that there is that picture that we can see, and then you see these little blood vessels, right? Those little red lines that look like little roads. And so diabetes, what happens is that it weakens the vessels, and then you can see it actually from the outside of the body. You can see this through these little flashlights, and you can see the vessels being ripped open, and blood is leaking outside of these vessels. And so it's almost like, think about it as the retina. Think about it as a computer board. And so the computer board is always there, and it has sensors, right? And so these sensors are always sensing the light. And so think about pouring water in this computer board all the time, or blood, right? So that's what happens with just imagine your computer if you're pouring like water on it every day, right? And so that's what starts happening with diabetes. These blood vessels get weak, they leak, and then they damage the computer board per se of the retina that sends the signals to the brain that we can see or not see. And so right here you can see that there's a little hemorrhage right there, so a little leakage of blood from the vessel, from the weakened vessel from diabetes. And then there is a little hard one too, the hard exudate. That was just a fancy word for, like, it's almost like a clot that gets formed. Um, they just get hardened and hardened, right? And so then what happens is that scar starts producing in these areas, and then the computer board or the retina just starts getting more damaged and damaged and damaged, and then before you know it, you don't have any eyesight and you're blind. And so here's the crazy thing, right? With type 1 diabetes, like when we get it as kids, we get diagnosed usually because like people lose weight, or because people are super tired or super thirsty, right? And these kids come into a hospital pretty sick, and so it takes a little time, for usually about like 20 years, for them to start developing these types of complications. Here's the crazy thing, right? Most of the people have type 2 diabetes. By the time you get diagnosed with type 2 diabetes, you've already had 7 years of damage to your eyes. 7 years. So this is pretty crazy, right? So you're playing catch up. And that's why when people tell me, like, oh, I'm just pre diabetic, like, this is a pretty big deal. Like, it's important to start taking a look at it, because you're about to lose your eyesight. And you've probably been 3 or 4 or 5 years already into being losing your eyesight, because by the time you get diagnosed, it's been 7 years. So please take a look at this, right? Because by the time you get diagnosed, it's almost like you're playing catch up, and you're trying to put out fires, and sometimes it's too late. And so pretty important issue to take a look at. And so that's the main thing with the eyes, to that we that the problem in the little vessels. So these are little vessels, micro vascular damage, the little vessel damage from diabetes. This is what happens in the eye, right? And this is another picture right here for those of you listening. We're looking like at a drawing of the eye itself, and of the retina itself, of how it looks with the blood hemorrhage into it, and how it starts damaging the retina. So think about it like a computer board, how I described it. And so that's it with the eyes. And then the next complication that I want to talk to you about you guys is the nephropathy. So nephro is for the kidneys, right? And so these blood vessels start actually damaging the kidneys again. And so if you know about the kidneys main work is to actually clean out our blood and filter it out, take the toxins out of our bodies, and then also get rid of a lot of water, right? Like unused water. And so then, as people start getting their kidneys damaged by diabetes, um, these the kidneys stop working, and so then these toxins start accumulating in the body. It's about $30 billion that gets spent in this issue alone, from diabetes damaging the kidneys, which is pretty crazy. So if we lose all of the function of the kidneys, what happens is that people start have to go in dialysis, right? And so we see that at the hospital all the time. We have to put the patients in dialysis, and so what that means is that they have to go to this little place to get dialysis at least 3 times a week, and they have to stay there for like 4 to 6 hours. It's pretty toxin. Actually, it completely changes people's lives. I mean, and they get emotionally really devastated. I've seen few people that keep trucking along and they do really well through it. Most people by this time are like in disability and just a pretty bad road to go down. But some people do just kind of keep going through it depending on their how they got there and that sort of thing. But the crazy thing about dialysis, the dialysis used to be like it was like getting a transplant. Like it was really hard to get into it. You had to apply. They had to make sure that you were serious about your health. And now what's happened is that it's become a lot cheaper, of course, and so they can give it to a lot more people. Now you can get it at your like in a lot of malls. They have like dialysis units, and so people go in there for 4 to 6 hours. And so the diabetic part, and so diabetes causes about half of these kidney problems. So when the kidneys are failing, it causes about half of them, and so it causes a lot of problem for people. And so then what starts happening is that these toxins start accumulating in the body. The electrolytes get out of range. Your heart starts getting affected. Your brain starts getting affected. People start getting like cloudy thinking, cloudy thoughts. It takes about 15 to 25 years to develop with diabetes. And some people would argue that even in 10 years you start having problems. And so, and about 2% of the patients with diabetes get this like really bad. Um, and so that's kind of what we wanted to talk about today. And that is we've talked about the eye, we talked about the kidneys, and the last thing I wanted to talk about was the neuropathy, right? And so the small vessels of the body are affecting, we talked about the eyes, and then we talked about the kidneys, and now the nerves too, because the nerves need fuel also. And the diabetes starts clogging up and making all these little vessels so weak, and so these vessels start leaking blood and not getting blood to where it is needed, and so some of the nerves start actually getting damaged. um, and that ends up in damage of the blood. And so how do these people present to the office is actually pretty bad. Is they get they get a lot of pain in the foot. They start getting a lot of pain, and they come down with a lot of pain in their foot, and the pain almost feels like they're burning, right? And so the symptoms come at night, and then they get burning sensation in the feet mainly, and sometimes in the hands. It's like they have a glove of like burning sensation. Also, they lose the reflexes, they lose the sensation, and they end up with severe pain. And also, there is something called diabetes amyopathy, where they kind of start losing their function, their feeling in their thighs. So, pretty severe. I'm gonna share with you guys what a severe case looks like right here. And this is what is called Charcot's disease. For those of you who are listening, the foot starts looking with like this bottom, it's almost like starts looking like a ball underneath, and it's pretty severe. Like the pain is pretty bad for people. People can't even walk. It's like a rocker bottom foot deformity. Rocker bottom foot deformity. For those of you who are listening, it's almost like a rocker bottom foot deformity. And so that's the main things that we wanted to talk to you guys about today. Those are the three main complications from diabetes that have to do with the small blood vessels. And so next episode, I'm going to be talking about the macrovascular complications. So that is the big vessels. What does diabetes do to the big vessels? And so that is it for today. And if you guys have any questions, comments, concerns, please let us know in the comments. And if you have any suggestions for any of the episodes, stuff that you want to talk about, I'm thinking about making these where people can call in for a little bit of questions, or having like a conversation with somebody to like as they ask me questions about these issues. We'll see how that goes. But if you guys have any questions, recommendations, or suggestions, please let me know. If you like it, comment below. That way I know that this is valuable information. Comment, like, share it. If you think that this is useful for other people. And that is it for today. So until next time, remember, take it easy. Zulu time.